Hello everyone. Today in this video I am going to discuss the topic called vital signs. Now question arises, what is vital signs and what are the vital signs? Let us see one by one. First one is introduction. Those physical signs concerning functions which are essential to life, that is known as vital signs. Vital signs are also called the cardinal signs. Through findings of vital signs, deviations of functioning in the vital organs such as heart, lungs, blood vessels and brain can be detected. Suppose if the person is suffering from any type of the heart related disease or the lungs related disease, we can detect through the vital signs. Vital signs includes temperature, pulse, respiration, blood pressure, oxygen saturation and a pain. What are those? First one is temperature, pulse, respiration, blood pressure, oxygen saturation and pain. Okay, now let us see temperature. Now we can see the definition of temperature. The definition of temperature is amount of heat maintained by the body or difference between heat production and heat loss is called body temperature. Amount of heat maintained by body or the difference between heat production and the heat loss called body temperature. Now normal ranges of the temperature. Mainly there are four types of sites of temperature. First one is oral temperature, axillary temperature, rectal temperature and tympanic and temporal arterial temperature. What is the normal range of oral temperature? That is 37.8 degrees Celsius. What is the auxiliary temperature normal range? 36.2 to 37.5 degree Celsius. Rectal temperature's normal range is 99.6 Fahrenheit to 37.5 degrees Celsius. And last one is tympanic and temporal arterial temperature normal range is 99.6 Fahrenheit to 37.5 degree Celsius. Now the question is sources of heat production. It means how our body will produce the heat. First one is disease condition. Suppose if the person is suffering from any type of infection, automatically what happens, our body's temperature will increase. That is the one of the source of heat production in our body. Second one is oxidation of the food. Third one is specific dynamic action of the food or the thermic effect of the food. Fourth one is exercise. If you are doing a lot of exercise, that time what happens, automatically body's temperature will increase. Okay, fifth one is hormonal effect. Sixth one is shivering. Now we can see sources of heat loss. There are four types of sources of the heat loss. First one is the radiation, second one is convection, fourth one is evaporation and the fourth one is a conduction. Here you can see the image. Okay, now let's move on to the clinical thermometers. There are two types of thermometers here. One is manually thermometer, another one is a digital thermometer. This is manual thermometer and this is digital thermometer. You can see the parts. Here this is the expansion chamber, this is a glass tube, this is a scales line, this is a capillary tube, this is column of the mercury, this is a constriction, this is a mercury bulb, this is a steam. Okay, for the digital, this one is a power button, this is a battery cover and here this is a display window and this is a probe tip. Okay, now you can see the here there are two types of temperature. Now just tell me which is the rectal thermometer and which is the oral thermometer. Okay, here this is the oral thermometer and this is the rectal thermometer. How we are going to differentiate? Come, we'll show you. Oral thermometer has a long and cylindrical bulb and rectal thermometer has a thick and short bulb. You can see here. This is oral thermometer has a long and cylindrical bulb and rectal thermometer has a thick and short bulb. Okay. Here steam containing readings of 35 to 43.3 degrees Celsius or 95 to 110 degree Fahrenheit. Now move on to the how we are going to disinfectant of the thermometer. You can usually we're using the Savlon 1:20 or the Lysol 1:40 or the Dettol 1:40. With the help of these, we can disinfect the thermometer within 5 minutes. Each small line of clinical thermometer is equals to 2 by 10 degree or Fahrenheit. Avoid thermometer washing with the hot water to prevent breakage. If suppose if you're washing the thermometer with the help of hot water, it will break down. That's why we have to avoid washing with the hot water. On breaking of thermometer, suppose that thermometer will breakage. What we will do? First one, pick up the mercury by the eyedropper or a heavy paper piece and seal in the plastic zipper bag. After that, then in a second bag, then in the third bag, and then in lastly in the plastic wide mouth. Sealed container, avoid sweeping vacuum or the use of cleaning agents. Now this is a formula to change one scale to another scale. One scale to another scale means this is a formula to calculate the thermometer or the temperature. One scale changed to the another scale by the following formula. You can see here. Okay. Now we are going to move on to the topic common sites of temperature. First one is oral temperature. You can see picture here. Okay. Oral temperature obtained by placing a thermometer under the patient's tongue with the lips closed for 2 minutes here. Okay. Wipe the thermometer from bulb to steam before and steam to bulb after taking temperature in a rotating motion to clean. Follow principle of less to more contaminated. Okay. Temperature obtained by the placing a thermometer under the patient's tongue with the lips closed for 2 minutes. Common sites of temperature. This one we can see contraindications. Nurse must wait for at least 50 to 30 minutes after ingestion of hot or cold liquids and smoked or the shaved, and it is not advisable for infant. As a nurse, it's your responsibility to check before we are going to do for infants or the adult. Okay. Next one is individuals who breathe through the mouth or on oxygen therapy. Next one is comatose or obtunded having diminished arousal and awareness patients or the critically ill. If the patient is suffering from critical or if the patient is having oral cancer, that time we have to avoid taking oral temperature. In case of oral surgery or the oral cancer of the oral infection, that time you have to avoid the taking temperature from the orally. Okay, clear? Okay. Next one is the rectal temperature. Here you can see the image of rectal temperature. Okay, we have to insert the thermometer into the rectal. Insert the thermometer into the anal canal to a depth of at least 1.5 inch, 3.8 centimeter for adult and not more than 0.5 inch, that is 1.25 centimeter in an infant, and hold it in a place for 3 to 5 minutes. 3 to 5 minutes hold it. And it is a more accurate than either oral or the axillary temperature. This question they asked in the NOSET also. It is a more accurate than either or the oral axillary temperature. This is a more accurate because it not interferes with external environment. Okay. It is an alternative option of oral method if contraindication for taking oral temperature. If the contraindicated we are taking the oral temperature, then we have to use this rectal temperature method. Lubricate the bulb of thermometer before inserting. Before inserting the thermometer, we have to lubricate the bulb. Okay. Place the client in the Sims position during the taking temperature. If you are taking rectal temperature, then we have to provide a Sims position to the patient. What are the contraindications of rectal temperature? Not to be used following a rectal surgery or if the rectum is diseased. If the person is suffering from any type of diseases related to the rectum, you have to avoid this method. Okay. And suppose if the patient is having piles, then we have to avoid these things. Okay. Children with the diarrhea, fecal impaction or rectal bleeding. Newborn not used for 1 to 6 year children. This method is not used for the 1 to 6 year children. Patients of a heart disease or the heart surgery because it's slow heart rate by vagus stimulation. We have to avoid these types of the patients. Okay. A spinal cord injury and increase the WBC. If the patient is suffering from increase the WBC of the spinal cord injury, that time we have to avoid this method. Next one is auxiliary temperature. It is a one of the accurate as the oral. It is one of the accurate as the oral, rectal and the tympanic method. So it is used only if other methods are contraindicated. The temperature obtained by the placing thermometer in the apex of the dry axilla with the arm pressed closely to the side of the body for 3 to 5 minutes. You can see this image. You have to insert like this. And last but not the least, tympanic and the temporal artery temperature. Tympanic temperature is obtained by the inserting the probe into auditory canal. We have in the ear we have one auditory canal. We have to insert that tympanic temperature, tympanic thermometer in our ear. Okay. After that, in the temporal artery temperature, the thermometer probe is placed flush against the skin of the forehead. I hope you understood my class. If you get any information from this video, then please subscribe, like, share and comment down in this video.